For vitamins you should never touch after 60, and 4 you must take every single day. If you're over 60, chances are someone has told you for years that taking a handful of vitamins every morning is one of the smartest things you can do for your health. One pill for your bones. Another for your heart. Maybe one for energy. Simple, right? But here's the shocking truth most seniors never hear. Some of those daily vitamins might actually be making you weaker, foggier, and even sicker. Clinical research reveals that certain supplements, the very ones advertised as essential for older adults, can quietly build up in your body. They overload your liver, harden your arteries, and in some cases raise your risk of stroke or nerve damage. And here's the part no one talks about: these aren't rare, exotic pills. They're the everyday vitamins sitting in medicine cabinets across the country. Why so dangerous? Because the body changes with age. The liver doesn't filter as powerfully as it once did. The kidneys can't flush as efficiently. Your blood vessels and nerves become more fragile, more vulnerable. What was harmless at 40 can turn into a silent trap at 65. That's why in today's video, we'll expose 4 vitamins you should never take after 60. Just as important, we'll uncover the 4 vitamins you should take daily, the ones proven to protect your brain, preserve muscle, and even extend life. And trust me, you'll want to stay until the very end. Because vitamin number 1 isn't hype, it's backed by hard science showing it reduces the risk of death from all causes by an incredible 36%. That's not marketing. That's real data. So grab your supplement bottles, check the labels, and follow along. Because what you discover today could mean the difference between pills that quietly drain your strength and nutrients that give you back your vitality. Worst vitamin number 4, vitamin A, retinol, the hero that turns toxic after 60. At first glance, vitamin A sounds like a lifelong ally. Doctors praise it for sharper vision, glowing skin, and a stronger immune system. And yes, that's true, but only in the right form and in the right amount. What most people over 60 don't realize is that too much of one type of vitamin A, retinol, can quietly build up inside your body and transform from a hero into a hidden toxin. Here's why. Unlike water-soluble vitamins like C or B that simply flush out in your urine, vitamin A is fat-soluble. That means your body stores it in your liver and in fat tissue. And as you age, your liver slows down. Your fat distribution changes. What you swallow today doesn't leave tomorrow. It lingers, stacking up like drops of water in a glass until one day it spills over. And when it spills, the symptoms often look like just old age: dry skin, brittle hair, dizziness, blurry vision, stiff joints, constant fatigue. But science reveals the danger goes much deeper. A 2022 review in the European Journal of Clinical Nutrition showed that seniors with excess vitamin A faced a 25% higher risk of atrial fibrillation, an irregular heartbeat that dramatically increases the odds of stroke after 65. Imagine that, one harmless-looking pill quietly nudging your heart toward catastrophe. So, how much is too much? If your multivitamin lists more than 700 micrograms daily for women or 900 for men, in the form of retinol or retinol palmitate, you're already in the danger zone. And sadly, many senior formulas exceed that threshold without you even noticing. But here's the good news: you don't need to abandon vitamin A altogether. Your body still needs it, but in its safer form, called beta-carotene, found naturally in sweet potatoes, carrots, spinach, and eggs. The magic of beta-carotene is that your body only converts it to vitamin A when it truly needs it. No excess. No overflow. Think of it like a smart fuel tank that only fills when you're running low. Retinol, on the other hand, just keeps pouring in until the engine floods. The bottom line: if you're over 60, check your supplement label. If it lists retinol or retinol palmitate, it may be time to rethink. Let your body decide how much vitamin A it needs by getting it from natural food sources instead of synthetic pills. Because after 60, health isn't about adding more. It's about choosing wisely. Worst vitamin number 3, iron, the energy booster that backfires after 60. When people hear iron, they immediately think of energy. Doctors prescribe it for fatigue. Supplement companies pack it into multivitamins as the secret weapon against weakness. For decades, iron was sold as the cure-all for pale skin, brittle nails, and exhaustion. But here's the hidden truth nobody tells seniors: after 60, taking iron when you don't actually need it can quietly become toxic. Unlike water-soluble vitamins, iron doesn't flush out. It lingers. It piles up in the liver, the heart, the pancreas. Over time, if you keep swallowing iron your body doesn't need, it doesn't vanish. It rusts you from the inside, the way old pipes corrode and weaken silently. Why does iron turn dangerous as you age? Because men stop losing iron after puberty. Women stop after menopause. That natural iron release valve is gone. Unless you've been diagnosed with anemia or have blood loss from surgery or ulcers, chances are you're not deficient at all. Every extra pill you take simply sits inside your organs, sparking oxidative stress, where unstable molecules attack your cells, aging them before their time. The consequences? A 2018 study in Alzheimer's research and therapy linked iron overload to a higher risk of dementia. Other research ties it to heart disease, liver damage, and even certain cancers. And here's the cruel part: iron overload often doesn't scream its presence. The symptoms are vague: joint pain, stiff muscles, chronic fatigue, memory fog, irregular heartbeat. Easy to dismiss as just getting older. Meanwhile, that so-called energy booster could be eroding your heart, your brain, your very vitality. So why do so many seniors still take it? Because most multivitamins still sneak it in, even though the vast majority of older adults don't need it. Add to that the iron you're already getting from red meat, beans, and fortified cereals, and the overload gets worse. Here's the smarter approach. Check your labels. If your multivitamin contains iron and your doctor hasn't diagnosed a deficiency, switch to a senior-specific formula without it. Ask for a blood test. A serum ferritin or transferrin saturation test will tell you if your iron levels are actually too high. Rely on natural foods. Lean meats, beans, and leafy greens give you enough without pushing your body into toxic territory. The takeaway: iron is vital when you're young and losing blood every month. But after 60, your body usually has all it needs. Extra iron doesn't give you strength, it steals it. Real energy in your later years doesn't come from forcing iron into your system. It comes from protecting your organs, reducing inflammation, and feeding your body only what it truly requires. Worst vitamin number 2, calcium supplements, the bone savior that can betray your heart. For decades, older adults have been told one simple message: if you want strong bones, take calcium every day. It's on TV commercials, doctor pamphlets, and stamped across nearly every bone health multivitamin on the shelf. But here's the shocking truth: calcium supplements, especially when taken alone, can do more harm than good after 60. When you're young, your bones act like sponges, quick to absorb calcium, guided perfectly by hormones and growth factors. But after 60, that system slows down. Bones lose their efficiency, and the calcium you swallow doesn't always end up in your skeleton. Instead, it wanders. It strays into places you don't want it. Into your arteries, stiffening blood vessels and raising your risk of heart attack. Into your joints, adding to stiffness and pain. Into soft tissues, creating calcifications your body can't easily reverse. A 2016 review in the Journal of the American Heart Association confirmed this risk. Older adults taking calcium supplements had a 22% higher chance of heart disease. In other words, while you think you're protecting your bones, you could be weakening your heart. The first warning signs of excess calcium are subtle: digestive troubles like bloating or constipation, unexplained fatigue, foggy thinking, or achy joints. But over time, the risks escalate into hardened arteries and increased stroke risk, kidney stones, painful and recurring, blocked absorption of other nutrients like zinc, iron, and magnesium. And the cruel paradox: your bones may not get stronger at all. So, why does supplemental calcium fail? Because calcium doesn't work alone. It needs partners. Vitamin D3 helps absorb calcium into the bloodstream. Vitamin K2 directs calcium into your bones and keeps it out of your arteries. Magnesium balances calcium so it doesn't harden soft tissues. Without these cofactors, popping a plain calcium pill is like sending a delivery truck with no address. It just drops its cargo wherever it can. Here's the safer path. Focus on whole foods. Leafy greens, sardines with bones, yogurt, almonds, and chia seeds provide calcium in its natural, balanced form. Combine wisely. If you do supplement, pair it with D3 and K2. Move your body. Weight-bearing exercise is as important as calcium itself for bone strength. Watch your intake. If your multivitamin already gives you 500 to 1,000 milligrams and you're eating calcium-rich foods, you may be overdosing without realizing it. The bottom line, calcium matters, but not the way we were taught. Swallowing isolated pills can clog arteries, stiffen joints, and raise your heart risk. True bone health comes from balance, whole foods, the right nutrient partners, and movement. After 60, the question isn't how many pills can I take? Is the calcium going to the right place? Worst vitamin number 1, vitamin B6 in high doses, the energy booster that quietly damages nerves. Vitamin B6 sounds harmless enough. It's water-soluble. It supports energy. It nourishes the nervous system. What could possibly go wrong? Here's the hidden danger. After 60, high doses of B6 can actually poison the very nerves it's supposed to protect. Unlike most B vitamins that the body flushes out daily, B6 behaves differently. When taken in large amounts, it accumulates in nerve tissue. Over time, that buildup becomes toxic, slowly damaging fragile nerve fibers. Seniors are especially vulnerable because their livers detoxify more slowly, and nerves are already more delicate. The evidence is clear. A 2017 study in neurology found that older adults taking high doses of B6 were twice as likely to develop nerve damage compared to those within safe limits. And here's why most people miss it. The symptoms look almost identical to normal aging or even diabetes. Tingling hands and feet. Burning sensations. Loss of balance. Frequent falls. Weak muscles. Constant fatigue. Memory fog. All too easy to dismiss as just getting older, when in fact, the culprit may be hidden inside your supplement bottle. So, how much is too much? The official upper safe limit is 100 milligrams per day. But studies show that even 50 milligrams daily, long-term, can harm older adults. The problem is that many nerve health or energy support supplements on the market contain 100 to 250% of the daily limit in a single pill. Add in a multivitamin and fortified foods, and you may already be overdosing without knowing it. And unlike a deficiency, which is easy to fix, nerve damage from too much B6 can take months or even years to heal. In some cases, the damage is permanent. So what's the safer choice? Stick to food first. Chickpeas, tuna, turkey, bananas, and fortified cereals provide plenty of B6 naturally. Know your real needs. Seniors only require about 1.5 milligrams for women and 1.7 milligrams for men, not the megadoses in trendy supplements. Check your labels. If your multivitamin or nerve support formula lists more than 5 to 10 milligrams per dose, it's time to switch. Test, don't guess. Ask your doctor for a blood test before taking extra B6. Never supplement just in case. The takeaway, B6 isn't bad. In fact, it's essential. But more isn't better. Too much can silently steal your mobility, your balance, and your independence. After 60, your body only needs enough to keep nerves healthy, not a flood that burns them out. If you're taking B6 for extra energy or nerve support, it may be time to step back, read the label, and choose safer, food-based sources. Because with B6, the truth is simple: enough is medicine, too much is poison. From hidden dangers to real defenses, the shift seniors must make. So now you've seen them, for vitamins that look innocent on the label, but after 60 can quietly weaken your body, inflame your organs, and even damage your nerves. But here's the encouraging part. Avoiding danger is only half the battle. The real key to thriving after 60 isn't just cutting out the wrong pills, it's fueling your body with the right ones. Because here's the truth, certain vitamins and minerals don't just help a little. They can restore strength, shield your heart, sharpen your memory, and in some cases even extend your lifespan. And unlike the harmful ones, the next 4 nutrients are backed by some of the strongest scientific research we have on senior health. One of them has even been proven to lower the risk of death from all causes by a staggering 36%. So now, let's turn the page. From what you should never take, to what you must take daily if you want to stay strong, steady, and clear-minded at 70, 80, and beyond. And we begin with a mineral most seniors are quietly starving for, one that powers over 300 functions inside your body every single day. Best vitamin number 4, magnesium, the silent rebuilder after 60. If there's one nutrient most older adults are missing without even knowing it, it's magnesium. And the tricky part is, you rarely notice until the body starts sending subtle signals. Nighttime leg cramps. Trouble sleeping. Fatigue that won't lift. Even irregular heartbeats. Too often, these signs get dismissed as just old age. But in reality, they are classic markers of magnesium deficiency. Why does magnesium matter so much after 60? Because it's the quiet engine behind more than 300 biochemical reactions, including keeping your heartbeat steady, helping muscles contract and relax smoothly, supporting brain and nerve function, regulating blood sugar and insulin sensitivity, strengthening bones alongside calcium and vitamin D. But here's the problem. As you age, your body absorbs less magnesium from food. And many common medications for seniors, like blood pressure pills, acid reflux drugs, or diuretics, actually deplete magnesium even faster. The result? Even if you eat fairly well, your levels can slip lower and lower with each passing year. The risks are serious. A 2018 study in Nutrients found magnesium deficiency in older adults linked to a 50% higher risk of atrial fibrillation, an irregular heartbeat that raises stroke risk, increased likelihood of dementia and memory decline, greater risk of type 2 diabetes, higher levels of chronic inflammation, accelerating aging. No wonder doctors now call magnesium one of the most underrated nutrients for seniors. The good news? Replenishing magnesium can feel like turning the clock back. Seniors who correct deficiencies often report deeper sleep, fewer nighttime cramps, sharper focus, steadier moods, stronger balance, and less risk of dangerous falls. But not all magnesium supplements are equal. Magnesium oxide, cheap, poorly absorbed, and often causes diarrhea. Better choices for seniors: magnesium glycinate, citrate, or malate, gentler on the stomach and far more absorbable. The sweet spot? 250 to 400 milligrams daily, depending on diet and health status. Of course, food matters too. Great sources include spinach and kale, pumpkin seeds, almonds, avocados, black beans, lentils, and yes, even a little dark chocolate. But because modern soil has been stripped of minerals, food alone often isn't enough. That's why smart supplementation can be life-changing. Magnesium may not sound glamorous, but for seniors, it's the quiet machine that makes everything else run. Restore it, and those just old age problems, cramps, poor sleep, brain fog, may start fading away. Best vitamin number 3, vitamin D3, the sunshine switch against decline. If magnesium is the silent helper, vitamin D3 is the master switch, the nutrient that determines whether your bones stay strong, your immune system stays sharp, and your brain stays alert. Here's the hard truth. By age 65, your body's ability to naturally produce vitamin D3 from sunlight drops by more than 50%. Why? Because aging skin simply doesn't convert sunlight into D3 as efficiently. Add more time spent indoors, sunscreen use, or cloudy climates, and deficiency becomes almost guaranteed. Why is D3 so crucial after 60? Because it's not just a vitamin, it behaves like a hormone, influencing nearly every system in the body. Bone strength partners with calcium and K2 to keep bones dense and fracture resistant. Muscle protection deficiency leads to weakness and more falls. Immune defense helps fight infections and speeds recovery. Brain health supports mood, memory, and cognition. A 2020 review in the British Medical Journal revealed the stakes clearly. Seniors with low vitamin D had a 50% higher risk of respiratory infections and a 30% higher risk of death from all causes. That means everything, from heart disease and diabetes to dementia, becomes more likely without enough D3. The scary part? Most seniors have no idea they're deficient. The signs are subtle: constant fatigue, low mood, frequent colds, slow healing, achy bones, weak muscles, poor balance, and frequent falls. Sound familiar? Many write it off as just aging. But often, it's simply low vitamin D3. So how do you restore it safely? Dose wisely. Most multivitamins offer just 400 to 800 IU. But research shows older adults often need 1,000 to 2,000 IU daily to maintain healthy blood levels. Pick the right form. Always choose cholecalciferol, D3, not ergocalciferol, D2, which is weaker and less effective. Pair it with fat. Take your D3 with a meal containing healthy fats like olive oil, avocado, or salmon because it's fat-soluble and absorbs better this way. Check your blood levels. If they're low, your doctor may recommend a temporary higher dose to restore balance. Food can help too: fatty fish like salmon, mackerel, and sardines, egg yolks, and fortified milk or orange juice. But truthfully, food alone is rarely enough after 60. That's why supplementing wisely often makes the difference. Vitamin D3 is your body's shield against decline. Without it, bones crack, muscles weaken, immunity falters, and the brain slows. But with it, many seniors report renewed strength, brighter mood, and even a surprising lift in overall happiness, sometimes within just weeks. Best vitamin number 2, vitamin B12, the nerve protector and brain saver after 60. If vitamin D3 is the shield that guards your body, then vitamin B12 is the spark plug, the nutrient that keeps your nerves firing, your blood flowing, and your memory sharp. And here's the shocking truth: by age 65, 1 in 4 older adults is deficient in B12, and most don't even know it. Why does this happen? Aging changes everything. Your stomach produces less acid as the years go by. That stomach acid is essential for pulling B12 out of food. Add to that common medications, acid blockers for reflux, proton pump inhibitors, even metformin for diabetes, and the problem only deepens. Which means you could eat eggs, chicken, or dairy regularly and still not absorb enough to stay healthy. Why does B12 matter so much after 60? Because it safeguards 3 critical systems: brain and memory. It protects nerve cells, slows brain shrinkage, and supports clarity of thought. Blood. It helps form red blood cells, preventing anemia and crushing fatigue. Muscles and balance. It keeps the nerve signals to your legs strong, steady, and coordinated. Without it, fatigue is just the beginning. B12 deficiency can mimic dementia, depression, or peripheral neuropathy. Many seniors are told it's just aging, when in reality, it's a correctable nutritional gap. The warning signs sneak in quietly. Long-lasting tiredness or weakness. Forgetfulness, confusion, or brain fog. Tingling or numbness in the hands and feet. Loss of balance and frequent falls. Pale skin or brittle nails. And if left untreated, deficiency can cause permanent nerve damage. That's why testing and supplementation are so crucial past 60. So how do you restore it safely? The daily target is 500 to 1,000 micrograms, far more than the token amounts found in most multivitamins. Here's the smarter approach. Pick the right form. Look for methylcobalamin or cyanocobalamin, forms the body absorbs best in older adults. Choose the right delivery. Sublingual lozenges that melt under the tongue go straight into the bloodstream, bypassing the stomach. For severe cases, doctors may recommend injections. Don't rely on food alone. While salmon, tuna, sardines, eggs, beef, and yogurt all contain B12, the aging stomach often struggles to absorb it properly. The good news? B12 is water-soluble, your body flushes out the excess, so toxicity is extremely rare. The bottom line, after 60, B12 is your lifeline to a clear mind, steady nerves, strong muscles, and the independence to keep moving forward. Best vitamin number 1, omega-3s, EPA and DHA, the longevity nutrient seniors cannot afford to miss. If there's one nutrient that can truly transform how you age, it's omega-3. These healthy fats, especially EPA and DHA, don't just support health. They extend life itself. One massive study published in the European Journal of Clinical Nutrition tracked more than 42,000 older adults. The finding was nothing short of remarkable. Those with the highest blood levels of omega-3 had a 36% lower risk of death from all causes. That means fewer heart attacks, fewer strokes, sharper minds, healthier joints, and yes, longer lives. Why do omega-3s matter so much after 60? Because chronic inflammation becomes the silent enemy of aging. It fuels arthritis, weakens muscles, stiffens arteries, and accelerates brain decline. Omega-3s fight this fire head-on. Heart health. They reduce dangerous arrhythmias, lower triglycerides, and keep arteries flexible. Brain function. DHA is literally the building block of brain tissue, guarding memory, focus, and mood. Joint comfort. Omega-3s ease stiffness and soreness, making movement smoother. Longevity. They protect telomeres, the caps at the ends of your DNA, slowing cellular aging itself. But here's the problem, 68% of Americans over 60 are deficient. Why? Because few eat enough fatty fish, and modern diets are overloaded with omega-6 oils, corn, soy, canola, that throw the body out of balance and stoke inflammation. So how can you restore it? Eat more fatty fish. Aim for 2 to 3 servings weekly of salmon, sardines, anchovies, or mackerel. Supplement smart. Choose a high-quality fish oil with at least 1,000 milligrams EPA plus DHA daily. If you have heart disease or inflammation, your doctor may suggest 2,000 milligrams or more. Check the label. Look for purity-tested oils, free of heavy metals, and ideally in triglyceride form for better absorption. Take with meals, especially with healthy fats like olive oil or avocado for maximum uptake. Plant-based option. If you're vegetarian or allergic to fish, algae oil delivers DHA directly. Yes, you can get small amounts from chia seeds, flax seeds, walnuts, and pasture-raised eggs. But for true therapeutic levels, supplements are almost always necessary. Omega-3s are like nutritional insurance for aging. They protect your heart, brain, joints, and independence. And if you had to choose just one supplement to take every single day after 60, it should be omega-3. Because it doesn't just help you live longer. It helps you stay yourself longer. So now you hold the truth about vitamins after 60. Some, like retinol-based vitamin A, iron, isolated calcium, and high-dose B6, may quietly erode your health, speeding up aging, weakening your heart, and even damaging your nerves. They're the silent risks hiding behind labels that claim to be for seniors, yet in reality can make you feel older than you are. But when you choose wisely, when you focus on magnesium, vitamin D3, vitamin B12, and omega-3, you give your body exactly the support it needs at this stage of life. These are the nutrients that keep your bones solid, your mind sharp, your heart steady, and your energy alive. And the difference between weakness and vitality isn't luck. It's not just age. It's the small, daily choices you make. Every pill, every bite, every habit either moves you closer to frailty or closer to strength. At Better Health, we want you to remember this: aging is inevitable, but suffering is optional. If today's video opened your eyes, don't let it end here. Check the labels on your supplements tonight. Talk to your doctor about testing your vitamin levels. And most importantly, begin replacing the harmful with the helpful. Because your future health isn't written yet, you're writing it right now, with every choice you make. Tell us in the comments, which vitamin surprised you the most today? Was it one you're currently taking? And if you found this video valuable, tap the like button, subscribe, and turn on the notification bell so you never miss the health truths that help you stay stronger, longer. Remember, your best years don't have to be behind you. With the right nutrition, they could still be waiting just ahead.